Welcome back. We're here at the 27th Annual Alzheimer's Association Regional Conference at the Seattle Convention Center in downtown Seattle, and getting an opportunity as the day has progressed to chat with a number of folks who are involved in various ways with the association. Going to get another perspective right now from Bud Thompson, who is an advocate for the Alzheimer's Association. But thanks for the time. Your involvement with the association started when exactly?
It started last year. With the conference. I was actually involved with the Portland chapter, Oregon chapter. My mom lived in Oregon, and I was with her when she passed away. And experiencing that is something I would not want to share with anyone, and I would not want someone to go through it because it's a very emotional and devastating experience. You picture the person that raised you and taught you everything that is now just a shell and is not the person you knew and loved. And there's nothing you could do. There's nothing that can be done right now to delay the onset of the disease. There's definitely no cure for it. And so I thought I've got to do something to help people not experience what I experienced.
Wow. And that's so noble of you to even think to do, I know, Bud, because it's a busy world that we live in, and folks go through their own pain, their own experiences, and very often after it is all said and done in the wake of someone's passing, folks don't know what they can do. So how did you find out about the Alzheimer's Association to actually get involved in advocacy for them?
Well, I went on at the time it was a walk-in Alzheimer's in Portland, and with my sister, and at that event they had little brochures about the advocacy program, and so I sent the application in and saw that there was a forum going on in April, and so I thought, oh, I'll go to the forum. And at that time I was the only person from the state of Washington at the forum, and so this year we're going to have 5 people there, and I think it's great to see that. And we have appointments with Maria Cantwell and Patty Murray while we're there, so we're hoping it's a good positive experience for everyone.
And I know that you shared with us just a little while before we got going here on the airwaves that you actually attended the National Alzheimer's Association conference as well recently?
No, I've just been to the forum, the Alzheimer's Forum, Advocacy Forum.
I see, okay. And that is back in Washington, D.C., though?
Right, yeah, and it's a gathering. Last year it was about 600 people from all over the country that come and have appointments set up with their respective legislative representatives and senators, and can talk one-on-one about Alzheimer's and what we need to see it research for a cure.
Well, obviously that is part of what you do in an official capacity as an advocate for the association, but what else does the work involve?
Well, unfortunately right now my congressman is stepping down, Norm Dix, so I'm in the process of having to set up with another congressperson. But we try to meet with our representatives and senators both in Washington as a part of the forum, and then locally here with either them or their staff to talk about the issues.
But I'm interested to know from our legislators' perspective, at least as far as you're concerned and having worked with them as an advocate, are they aware of this issue? Are they aware of Alzheimer's, about what it does to people who unfortunately fall victim to it, what it does to the families in their wake, and where it's going as a science as well medically? Do they have any idea before you get there?
They did, because they almost unanimously, the House and Senate passed NAPA, that's a National Alzheimer's Program. I can't remember the other one.
Okay.
But anyway, but that was passed almost unanimously by the House and Senate a year ago. And so we're going back this year to talk more about that and get it actually enacted, so that get feet on it. But right now, the other main, what is it, 5 main diseases that cause death are in a decline, and Alzheimer's is at 66% increase, and the funding is just not being distributed to Alzheimer's, so not the association, but to research for Alzheimer's to find a cure. Because right now there is nothing. There's no cure at all. So it's just something that has to be done. Right now, every day, 10,000 baby boomers turn 65. And as you turn 65, you've got a 50% chance of having Alzheimer's. It's, I think, 75, it goes up to 70%, 85, it goes up to 80%. So, you know, your chances, I did a fundraising event and I said I have some good news and bad news. I says the good news is that our life expectancy is increasing. I said the bad news is our life expectancy is increasing. Because the longer you live, the more you have a chance of getting Alzheimer's disease.
Yeah, very true. And I know that another thing we learned inside of the convention center today during Dr. Gary Small's talk with us was the fact that every 68 seconds approximately there is a new case of Alzheimer's reported in this country. So it is, as you just said, Bud, on the rise, unfortunately, much more so than any other disease that kills in our society. And is there a stigma? I know you've gone through this as a family member, but is there a stigma attached to Alzheimer's? We've heard a lot about those today from various compartments of folks who are involved with the association. Did you experience that when your own mother went through the disease?
Well, it's, you know, some people call it old-timers disease, and unfortunately that's no longer true. People, you know, they make jokes about Alzheimer's people, and you just can't do that anymore because of the age range. There was someone at last year's forum that was 32 years old diagnosed with Alzheimer's, and you know, where are you getting caregivers for somebody that's 32 years old? Another thing I just realized is that for every $2.80 that's spent on caring for in Medicare or Medicaid that's caring for a person with Alzheimer's, the federal government only spends 1 cent for research.
Wow.
So it's like, you know, we've got a lot of money going to take care of this, and right now there's, what, 5.4 million, 5.3 million people with Alzheimer's in the United States, and by 2050 it's going to be 16 million. And the cost of taking care of those people is going to be over $1 trillion. And we can reduce that if they increase the research and do something to attack it. But right now it's just not being done.
It sounds like, given those numbers, there's obviously an extreme lack of funding, especially from the federal level, as far as Alzheimer's research is concerned. Hopefully we will see that tide stemmed in the future. We'll be able to get a little bit more money and probably more attention than anything focused in this direction. But having gone through this as a family member, again, the survivor of someone with Alzheimer's, your mom who passed away, when you look back on the experience and you could share what it is that you learned from that experience with someone who's going through it themselves, what would you tell them? Is there any one thing or a couple things that really stick out through that process?
I'd say the main thing that sticks out is my sister was the main caregiver, and caregivers have to take care of themselves, and it just becomes so overwhelming, the responsibility of taking care of, in this case, our mother, that my sister was not taking care of herself. And so then she's no good to her or to my mom. And so I would say that the main thing is for caregivers' well-being, that they have the support they need. And that's something that is also included in most plans, either at a state or federal level, is caregiver support.
Yeah. Very true. Again, it's something that we talk about as far as caregiver support, respite programs through aging and adult care. Again, very valuable as far as resources are concerned for everybody that might be out there as a caregiver. Bud, again, we're very sorry to learn about your mom's passing and that you had to struggle with the disease, and certainly that she did too, but we certainly appreciate the fact that you've gotten on board and are helping with the fight, again, through advocacy with the Alzheimer's Association here regionally. Appreciate your time today as well, sir. Thanks.
Okay, thank you.